But we begin tonight with a dire situation at Michigan hospitals. We thank you for joining us here at 6. I'm Dave Llewellyn.
And I'm Carolyn Clifford. ICU beds in hospitals across our state are filling up with COVID patients. The most recent data from the state showing some facilities nearing capacity.
Right now, more than 1,000 COVID-19 patients are fighting for their lives in Michigan intensive care units, and emergency departments are seeing more than 2,000 COVID patients a day.
Hospitals are asking for ventilators and PPE. Add that to fatigue, and people are quitting in all departments.
Only on 7, we are giving you a look inside St. Joseph Mercy Oakland Hospital that, like so many others in our state, is at a critical point.
7 Action News reporter Kim Russo has this exclusive that's raising a lot of concern among health experts.
The president of St. Joseph Mercy Oakland says she believes it's important that the hospital let the community know when it's at a critical point. And it is at a critical point right now. I spoke to workers on the front lines and also met one worker who gives his co-workers hope. If you go to St. Joseph Mercy Oakland, you may be greeted by Octave Leduff. The patient services technician survived COVID-19 thanks to his co-workers during a 71-day hospital stay. Workers say he keeps them going. Still, in recent days, they're struggling.
I would say we're feeling very frustrated, burnt out.
Claire Diaz works in the ICU. A nurse took this picture of the ventilator and machines next to a COVID patient fighting for their life on her floor. Almost all the critically ill patients in the designated COVID wing of the ICU are unvaccinated.
With the unvaccinated cases, we're seeing that it's much harder for them to come off the vent. And at times they're on the highest settings, and their body, in terms of organs, and we call it multi-organ failure, they start depending more and more. And once they reach that point, it's hard to wean them off just because of how sick they can be.
We feel like we're drowning.
Dana Nowacki is an emergency room nurse. These are pictures of beds filled with non-COVID patients who don't have to be isolated lining the halls.
We started our day with almost 30 people that have been in the ER since yesterday that are waiting for beds upstairs that we don't have available. And then we still have people coming through the door.
We are at capacity, and we've been at capacity.
Shannon Strebick is the president of St. Joseph Mercy Oakland. The hospital, as I toured, had 78 COVID positive patients. She says leaders are having 3 meetings a day to ensure they can continue scheduled surgeries and handle the continuous flow of COVID-19 patients into the ER. She's calling on the community to vaccinate, socially distance, and mask up in the coming days, so there are no regrets.
Coupled together, to have a full ICU a week before Christmas, it's concerning. You know, it's really concerning.
A common thing that we see in the ER with those patients is this sense of remorse and regret, and they voice that to us, that they wish they would have gotten their vaccine. They wish they would have went to get their boosters. They wish they would wear a mask because they didn't think COVID was real. And now they're basically dying of it, and they just want to go back to a time where they could do something about it. And it's too late.
And even though they are so busy, hospital leaders don't want people who need medical attention to avoid the hospital because they're concerned about COVID-19. They want you to get life-saving care. They have screening policies and isolation policies that I witnessed in place to prevent the spread of the virus in the hospital. In Pontiac, Kim Russell, 7 Action News.
Go get vaccinated. Thank you, Kim.